In total, it's, well, in absolute numbers, it's 50,000 deaths in 2009. And the number of diseased due to circulatory diseases is probably increasing elsewhere in Japan. This is Slovakia Predictive, Preventive and Personalized Medicine blog, which I've stated just to give a brief overview of the implementation of EPPM concept in Slovakia. And well, if you wonder, that's what I put there, that it's 5:45 to 6 a.m. in Slovakia, so it's not p.m. just to be sure. From prediction, I have assessed it on my own information, and it's maybe a bit subjective, but I try to use all the information I have. So it looks like we have to start working at least at 6. So it's a lot of work is expecting to be done in Slovakia from this point of view. What is stressed in Slovakia is prevention is most stressed. From those 3 P, prevention in Slovakia is really stressed in all programs, and there are many programs you can find on the web pages of Slovak Ministry of Health. Health economy is really, I think, it's bad, and we have to also pay attention, as already stressed, to education, ethics, legislation, quality assessment. I put it in just in one slide, in one piece, but it should have been divided in all the areas. So, in the conclusion and recommendations, what was stated in our article, and of course in the article in the EPMA journal, more information is stated on the Slovakian healthcare system. But we managed to get in contact with the Slovak Ministry of Health, and we are in contact. They are informed about this concept of EPPM. They were also invited to this Congress. First they promised, then they changed their mind, unfortunately, so no representative of Slovakian Ministry of Health is coming, unfortunately. But what we have proposed in our article is that we should pay more attention to modern laboratory diagnostics and in vivo diagnostics and their predictive potential, complemented by in silico diagnostics, which will be discussed on Sunday at this Congress. We should implement EPPM education programs, as we have heard yesterday, that they are trying in Czech Republic, at appropriate levels of education system in the Slovak Republic, and emphasize the role of healthy nutrition. But yesterday we had a session on nutrition, and it was very important. And we have to stress it all the time, because I think nutrition is one of the most important ways how to decrease problems with the cardiovascular disease and all the related diseases. It's well known, on one hand it's well known, but on the other we behave completely differently. Also, we should pay attention to affordable and convenient analysis of the individual food. Because what we have heard yesterday, that okay, you eat apple, you eat vegetable, but the question is, okay, what do I really eat? I mean, is this healthy, or there are some contaminants or toxic compounds in the food? And this is important. So we have to know what we eat. So that's why we should stress this, and we should also motivate people who do take care of their own health. Because now it seems in Slovakia that, okay, well, take care about your own health, but pay the same amount of money, or even more. Okay? So we have more money for people who do not take care of their own health. So this is what I don't call solidarity. We should also support implementation of recent information technology at all levels of the health system, stress personalized aspect of healthcare, and treat individual patient, not a statistical entity that's called public health. because public health should arise from the individual health, and then we can speak of public health in general. It's not the other way around. We should allocate financial resources now, and it is expected that the investment will return in the future. What we should also do is decreasing the consumption of medical drugs, and we should also state new standards for the quality in healthcare at all levels. So we should prepare profiles of the desired healthcare provider and say, okay, we want you as a healthcare provider to do this, and that. And these standards should be clear and effective. So, in the last slide, I have found this beautiful animated GIF on the webpage, and this is what I see describes the healthcare system now. If you see a parallel with the healthcare, then you think the same way as I do, because this is a steady state at the sinking boat. Yeah? If you pour out the water that is coming in, you can do it for some time, but judge for yourself how long can this guy be doing this. So sooner or later, the boat will be sunk. With this picture, I thank you very much.